Good afternoon, everyone. Thank you for joining us today. I've got quite a lot to cover in my opening remarks today, so please bear with me, but it's all by way of important and I hope useful update for you. First of all, today's statistics. The total number of positive cases reported yesterday was 2,649. That is 11.3% of the total number of tests carried out, and the total number of confirmed cases is now 143,715. 660 of the new cases are in Greater Glasgow and Clyde, 389 in Lanarkshire, 357 in Lothian and 302 in Tayside, and the remaining cases are across 9 other health board areas. I can also confirm that 1,467 people are currently in hospital. That is an increase of 83 from yesterday. Now, this number pretty closely now matches the numbers that were in hospital at the peak of the first wave back in April. 100 people are in intensive care, which is 5 more than yesterday. Now, the intensive care number is still well below the peak that we saw back in April, but nevertheless, I want to stress that pressure on our ICU units is increasing, and total intensive care occupancy, which will be COVID and non-COVID patients in intensive care, is now above normal capacity across the country. And both of these figures really do underline why it is so important now that all of us play our part in stopping this virus spreading, so that we, amongst other things, of course, contribute to a situation where that pressure on our hospitals is not continuing to increase. I can also confirm, unfortunately, that 78 additional deaths have been registered in the past 24 hours of patients who first tested positive in the previous 28 days, and the total number of deaths under the daily measurement we use is now 4,779. National Records of Scotland has also just published its weekly update, and that, as you will recall, includes cases where COVID hasn't been confirmed through a test but is suspected or a contributory cause of death. Today's update shows that by Sunday just past, the total number of registered deaths linked to COVID under the wider definition was 6,686. 183 of these were registered last week, which is 17 fewer than in the previous week. Of those 183 deaths, 111 occurred in hospitals, 63 in care homes, and 9 at home or in another non-institutional setting. Of course, every single one of these deaths, which I report every day here as statistics, represents a human being that was loved by their families and friends, and they serve as a reminder of the toll this virus is taking and the heartbreak it is causing far too many families across the country. So again today, to each and every one of you who might be grieving somebody right now, my condolences and thoughts are very much with you. The Scottish Government will also later today publish the latest estimate for the R number. That will show that the R number undoubtedly remains above 1, although of course that estimate can't take full account of any changes that might have happened as a result of the new restrictions that we've introduced this week, although it is probably too early for those changes to have resulted in any change to these statistics. There are 3 other points that I want to update on today. The first is that Public Health Scotland has just published its weekly statistical update, and that includes, amongst other things, details of the progress of our vaccination programme to date. And I can confirm that this shows that by Sunday, the 3rd of January, 113,459 individuals had received their first dose of the Pfizer COVID vaccine. We started using the AstraZeneca vaccine on Monday, and so next week's figures will include people who have received that vaccine. There are a few further points about the vaccination programme that I just want to expand on today to try to give you as much of a sense of how the programme is progressing. Now, in weeks to come, Public Health Scotland intends to provide a much more detailed breakdown by group of the population and also by region of Scotland of who has been vaccinated. But I am able to confirm today that we are now well over halfway through vaccinating care home residents with their first dose of the vaccine. That is extremely important. As you've just heard, more than 1/3 of the people who died with COVID last week died in our care homes. And we very much hope that the vaccine will very soon start to significantly reduce the risk of care home residents becoming ill with the virus. In addition, the programme for vaccinating all people over the age of 80 is underway. All over 80-year-olds will be starting now to get appointments either by phone or by letter. But I want to say today, don't worry if you haven't yet had your call or letter. These are being aligned with the availability of supply, and it will be coming to you soon. We are aiming to have all over 80s receive the first dose of the vaccine over the next 4 weeks. So if you're over 80 and you've not yet received your appointment letter or a phone call, there's no need for you to phone up your GP. You will be contacted with an appointment as soon as possible, and you will get your vaccination over the next 4-week period. The final point I want to make is that from next week, to support all of this, I can confirm that more than 1,100 vaccination sites will be operational across Scotland. These sites will mainly be GP practices and community vaccination centres at this stage. The number of vaccination sites will continue to grow as our supplies of the vaccine increase and as pharmacies and mass vaccination centres start being used to provide the vaccine. But from next week, more than 1,100 sites will be active and operational in getting this vaccine into people's arms. Now, we will keep you updated on the progress of the vaccination programme as we go along. And as part of that, I can confirm today that we have decided that from Monday next week, we will publish statistics every day, every weekday, on the total number of people vaccinated, which will help people see on an ongoing basis the progress that the programme is making. The weekly Public Health Scotland report will also, as I indicated earlier on, as soon as possible, give more detailed breakdowns of the numbers vaccinated in each group and each part of the country. However, I hope that today's initial information provides some assurance that the vaccination programme is already starting to protect a significant proportion of the people who are most vulnerable to COVID, particularly those in our care homes, and that the programme will grow rapidly in scale in the coming days and weeks. Vaccination ultimately is what will provide us with the route out of this pandemic. So we are absolutely determined to ensure that as many people as possible are vaccinated just as quickly as it is possible to do so. Now, the second issue I want to update on today relates to temporary regulations to protect people from the risk of being evicted from their homes during the pandemic. Early on in the pandemic, the Scottish Government acted to prevent evictions by extending the notice period required for action. But last month, we introduced regulations to prevent eviction notices from being enforced at all, with only some very limited exceptions. These regulations are in place until Friday 22nd January. They were originally intended as a temporary action to protect public health by ensuring that evictions couldn't take place over the Christmas and New Year period. Since those regulations were introduced, though, we've seen a major increase in new cases, and the new variant, of course, is gaining ground rapidly. That means, if anything, there's now an even greater public health need to prevent evictions than there was even back in December. It's become even more important to stop people from needing to find a new home or perhaps from having to move in with a different household. For that reason, therefore, the regulations to prevent the enforcement of eviction notices will be extended until the 31st of March in all Level 3 and Level 4 areas, which of course right now is the entirety of Scotland. And if necessary, the regulations can be extended further after that date, and we will review that position, of course, as we get closer to the 31st of March. Now, as is currently the case, there will continue to be limited exceptions in these regulations. For example, it may still be possible to evict someone if they are guilty of antisocial behaviour or other criminal behaviour. Overall, though, these regulations should stop the vast majority of eviction notices from being served, and that will help us protect public health by helping people to stay in the same household and also, I hope, provide reassurance for tenants living in private or social rented housing. Now, the final point I want to make today is to emphasise again our key public health guidance. And as part of that, I want to stress today in particular the importance of everybody working from home as much and as far as they possibly can. Working from home, if it's possible to do so, is now a legal requirement in almost all parts of Scotland, and that includes all of the mainland of Scotland. Many businesses have already shown great flexibility in enabling more workers to work from home, and I'm grateful to them for that. But I want to stress again the need for all companies to do so as much as they possibly can. All employers should be reviewing their operations to allow as many people to work from home as possible. In particular, they should only be asking people to come into work if it is for work that cannot possibly be done from home, and if it is for work that is genuinely essential. That also applies, and this is a point I want to stress too, that applies to takeaway businesses and to non-essential shops that are providing click and collect services. If you can provide delivery services instead, you should do that, and that will reduce the need for people to leave their homes, and it will help all of us to fight this virus more effectively. The bottom line here, and I need to be really blunt about this, is that for this lockdown to be as effective as we really need it to be, we must radically reduce the number of interactions we are having, and that means reducing to a minimum the reasons people are required to leave their homes. Now, if we need to require more non-essential activities to close in order to achieve this, we will have to do that, and that's a matter of ongoing review by the Scottish Government right now. However, businesses can help now by limiting as far as possible the numbers of workers that they are asking to leave their homes, and I'm asking them again to do so. But although there is an important role for employers here and a particularly important role for government in all of this, reducing the risk of transmission is also a responsibility of all of us as individuals, and this is the point I want to conclude on. Each of us needs to play our part right now in slowing down the spread of this virus and reducing the number of people who get infected while the vaccination programme starts to have an impact. Remember that race analogy that I used the other day. We need to speed up the vaccine, but we also need to slow down the virus, and that is up to each and every one of us. And the best way of doing that is to stick to these new lockdown rules. Stay at home as much as possible. Only leave your house for genuinely essential purposes, such as caring responsibilities, essential shopping or exercise. Work from home if you possibly can, and please do not go inside other people's houses unless it is for an essential purpose, like caring for someone who is vulnerable. And remember that the rule for meeting people outdoors now allows just 2 people from 2 households to get together. And finally, if you are out and about, please continue to remember and abide by facts. Wear face coverings when you're out doing, for example, essential shopping. Avoid anywhere that is busy. Clean your hands and hard surfaces. Use 2-metre distance if you are talking to someone from another household, even outdoors. And self-isolate and book a test if you have symptoms. On any occasion when we do require to be outside our own homes, these measures still help us to break the chains of transmission. But fundamentally, although it is incredibly difficult, the best way we have of protecting ourselves right now is to go out and about as little as possible. Staying at home is how we stay safe, it's how we protect ourselves and our loved ones, and it's how we slow down this virus while we speed up vaccinations. Last point is this. Staying at home is also how all of us help our National Health Service do the incredibly difficult job it has on its hands right now. Our NHS is coping, but as you saw from the statistics I reported earlier on, it is under severe and increasing pressure. Every single person who gets infected with this virus is somebody who might need hospital care in future. So the more all of us stay at home and reduce the opportunities for the virus to spread, the more all of us help the NHS cope. I saw talk yesterday of restarting the weekly clap for the NHS, although expanding it to include others who are contributing so much right now. And let me be clear, in mentioning this, don't take from it that I'm in any way against that. Everything we can do to show appreciation for those working so hard on our behalf is important. But I strongly suspect that what most frontline NHS workers really want from the public right now is for all of us to do everything we can to stop the virus spreading. So please, I'm asking everybody, heed this message and please help get it across to everyone you know who might not be watching right now. Stay at home, protect the NHS, save lives. That is now just as important as it was last March. and I ask everybody to take it just as seriously as all of us did back then. Thank you very much for bearing with me and listening through all of those updates. I'm going to move straight to questions now. As you can see, the Chief Medical Officer is joining me today, and he will, of course, be helping me answer the questions. But firstly, today I am going to ask Fiona Walker from the BBC.
Thanks, First Minister. Can you tell us how long, after all care home staff and residents are vaccinated, can they return to indoor visiting? And is that after the first or the second dose? And for families who consented to their loved one being vaccinated, on the basis it would be 2 doses 3 weeks apart, some now feel left in limbo. What do you say to them?
On both of those points, I'm going to hand over substantively to the Chief Medical Officer, because it's important people hear on these really important matters from a clinician, somebody who is qualified and expert in these matters. Very, very briefly then from me, in terms of the time after the first and then later the second dose of the vaccine, for the degree of immunity to kick in, it's not immediately. It is, Gregor can give a bit more of the detail, 2 or 3 weeks, but the other important thing to remember about this vaccine is that while there is very strong evidence that it helps to stop people who might get the virus becoming seriously ill and dying from the virus, there is still not yet certainty about whether it stops people getting and transmitting the virus to others. So there are some complex issues that we still have to consider and work through before we can say people getting vaccinated means that we can open up things. And obviously your question is about care homes, but my answer is more general than that. And on the 2 doses, you know, I'll let Gregor talk about that. These are decisions that are not taken lightly, but right now we're in a very, very serious situation. We're in a race against this virus, and vaccination is what's in our lane of this race that can beat the virus. And therefore we've got to get as many people with as much immunity to it as possible, vaccinated as quickly as possible. And that's the basis for these decisions. But I'll hand over to Gregor, who can give a much more clinical and expert answer to what I know are important questions for people.
Thank you. So I think the key point, particularly in relation to care homes visiting, is about, as yet, the undetermined effect that both these vaccines have on transmissibility. And there is more work which is underway to try to understand that better, so that we can shape the guidance for the future to see how much that influences a number of different areas of considerations as to how we treat that post-vaccination period for people. In terms of the immune response that people develop once they've had that first vaccine, what we know is that the body's immune system begins to kind of produce the protective proteins that the vaccine stimulates in the body from about day 10 onwards, and that begins to really ramp up from day 14. And by day 14 to day 21, we're starting to see really quite substantial levels of protection from that first dose with both vaccines. And the decision has been taken that, given the high level of protection that gives us in that period, the really important thing just now in this race that we're in against this virus is to make sure that we are maximising the number of people that we can offer that protection, particularly in those vulnerable groups. And we can do that best by prioritising that first dose and then revisiting the second dose at a later stage. The MHRA and JCVI have given us very clear guidance in terms of the approach to that, and both these organisations have studied the data and the safety efficacy behind both of these vaccines in some detail before making those recommendations.
Thanks. Gordon Cree from STV.
Thank you, First Minister. We've seen this morning vaccines being delivered at a GP surgery in Edinburgh, which is obviously a welcome development. Earlier this week, you said that you didn't have yet the guarantees and clarity over supply to be able to commit to a deadline of how long it would take to get all over 70s vaccinated. I just wonder if you've had any further information about supplies, because obviously people in that group are very keen to know how quickly they can be vaccinated. And to the Chief Medical Officer, just to pick up on this question about the doses and the gap in between them, a number of healthcare workers in hospitals have told me that they consented to getting the Pfizer vaccine on the dosage that was explained to them at the time, and that has subsequently changed after they've had the first dose. Is there not a case for ensuring that all the people who had already had it got it on the original schedule, and then any changes made going forward?
That would inevitably, of course, mean that some people, say in the over 80 category, that we hope to be able to vaccinate more quickly because of this change, wouldn't get vaccinated so quickly. But I'm going to let Gregor deal with most of these questions, because I'm a politician, he's a clinician, and I think it's important people hear the clinical views on this. In terms of your question on the scheduling of the different groups and when we expect them to be vaccinated, we are working through, and this is an exercise that is pretty much reviewed again on an ongoing basis, but we're working through right now our latest expectations around supply and the modelling of when we can expect different groups to be vaccinated, and we'll set out more detail of that hopefully very soon. What I said in Parliament this week was that we expected to have just over 900,000 doses over January. And within that, and this won't account for all of these doses, but today I'm saying that I'm saying that we're well over halfway through care home residents already. We are significantly through or well through NHS and social care workers as well. That's ongoing. And over the next 4 weeks, our expectation is that we will do all over 80s. Now, there will be more than that started as well, but we will give the deadlines for all of this as soon as we have the certainty around supplies to be sure that we have a degree of confidence in those. We're committed to maximum transparency. I've said today we will publish daily figures from Monday, although it will be the weekly report that gives a breakdown in due course of the different groups and the percentage vaccinated in each of them. But we also need to be as clear and as certain as we can in the predictions we're making, and that requires us to be certain about the supplies that are coming through and over what timescales.
I've heard people characterise this as a race that we're in just now, and I do think that's a good way of describing the analogy just now, because on one hand we have a new variant of virus which is gaining the ascendancy within the country just now, and we see the impacts and the effects that that's having across the UK just now, and in our own figures as well across Scotland, the rise in the number of cases that we're seeing over the last couple of weeks, we can directly correlate with the rise of the new variant within Scotland as well. So whilst that's on one side of the race, the other part, of course, is how quickly can we provide protection to as many people as possible using the two vaccines which are available to us. And when we look at the data in relation to this, what we see is that first dose of those vaccines gives a substantial, a really high degree of protection when we look at the outcomes that we're trying to achieve, that individual protection for people. So we can maximise the vulnerable people who receive protection during this phase of the pandemic, when this virus at the moment is really threatening to cause widespread issues across the country. We can protect both individuals, and we can protect also the health services which come under increasing pressure as a consequence of those people needing hospital care and treatment as well. So the Chief Medical Officers have taken the advice and support the advice, the position given to us by the JCVI in terms of that this data tells us this is the way that we can maximise the benefit to the population, and particularly to those within the population who are more vulnerable.
Thanks. Lewis Warner from ITV Border.
Thank you, First Minister. Probably a question for both of you. Yesterday, we learnt the sad news of a rather large outbreak at a care home in Stranraer. We know one resident has died, another 31 residents have tested positive, and another 31 members of staff too. The news on the vaccine rollout among care homes is obviously welcome, but given we're almost a year on now and the virus is still finding its way into care homes, is there anything else that can be done, especially considering the transmissibility of this new variant? What more, if anything, can be done to help protect these vulnerable people other than a vaccination?
I'll make a few points in response to that before handing over to the Chief Medical Officer. Firstly, I remember the last briefing where I made the first point that I'm about to make here. Some people said that I was trying in some way to minimise, outbreaks and infections and deaths in care homes. Please, there is absolutely no circumstance in which I would ever try to do that. But the point was to say that while every outbreak, every infection, every death remains a tragedy and is deeply regrettable, the numbers of care homes with infections and the numbers of people dying in care homes in this wave of the virus is lower than it was in the first wave. Now, it's still too high, and that's the point I want to be very clear. I am not minimising it in any way. But that does suggest that there have been lessons learned and there have been changes made to try to reduce the risk to older people in care homes. What more can be done? Well, the vaccination programme is the most important thing we need to do right now, and that's why, what I've been able to say today, that the well over half, so the majority now of care home residents have had their first dose, and a significant proportion of care home staff have been vaccinated as well, is the way in which we give the maximum protection to people in care homes. But we can all play a part. When we see infection levels in any institutions, whether it's hospitals or care homes here, to some extent that is reflective of the overall level of transmission in the community. So all of us, by trying to act in a way that reduces community transmission, we're also helping to reduce the risk of the virus getting into care homes. Because once it gets into an institution where the majority of people are in a highly vulnerable category, then it is going to take an even bigger toll than it will in society more generally. So that's the thing all of us can do. As I've said before, staying at home right now protects ourselves, our loved ones, the NHS, but it also helps to protect people in care homes because it's reducing that level of transmission that reduces the risk of the virus getting into care homes.
And you're right to single out vaccination as being something which will help us to protect those who are in care homes or those who are more vulnerable across the country at all. And in fact, the number needed to vaccinate in terms of somebody in a care home to prevent a death is only one person. For every 40 people that you vaccinate, you'll prevent one death, compared to a population figure in the tens of thousands. So, vaccination is incredibly important in order that we try to protect this group of people, and that's why we've prioritised it as in the first stage of our vaccination programme. But beyond that, the single most important thing that we can do, in addition to the measures that are already in place, is get community transmission as low as possible. We can all contribute to that. We can all contribute to that by making sure that we are as careful as we can possibly be in limiting our contact with other people, by staying at home, by making sure that we don't allow that community transmission to be perpetuated and accelerated across the country. And if we can do that as a community together, we stand the greatest chance of reducing the likelihood of the infection finding its way into these care homes as well.
Thanks. Alan Smith from Bauer.
Thank you, First Minister. Just in regards to the pressure you spoke about on hospitals, there's been more than 1,000 medics across the UK who've now signed an open letter calling for a better standard of PPE for hospital staff on general wards. The response from the Scottish Government has been that there's no evidence to suggest there's a change needed in the approach to PPE, but staff are clearly worried and concerned that this new variant will lead to a significant rise in staff absences. So if there's no enhanced PPE under consideration, is there anything else being looked at as a possible way to prevent the spread of this variant within hospitals?
Well, firstly, one of the priority groups for vaccination, and a group that we are, already well of the way through vaccinating, is vaccination. So NHS workers are, at the top of the list in terms of people that are being vaccinated. I always take very seriously the concerns of people working in the front line, because they're doing the job for all of us that, is very, very difficult, puts them under huge pressure, and by the nature of the job, puts them at greater risk. So there's a really important responsibility on the part of policy and decision makers like me to make sure they've got the best protection. So we will listen carefully and we'll respond to that. What I am advised, and I'll let Gregor say a bit more about this, is that the quality and the standard of PPE that is being used in our hospitals right now is appropriate, and that while this is a faster spreading variant of the virus, there is no evidence that PPE is any less effective against it than it would be against the previously circulating variants of the virus. So that is the basis on which that response was given yesterday, that there is no evidence that we need to change the quality of PPE. But on any of these things, I never want to sound as if I'm dismissing what frontline health professionals are saying, and we will continue to listen to them, to take expert advice, and to try to do as much as we can to assure those on the front line that they have the protection that they need and deserve and have every right to demand.
I think colleagues right across community and hospital-based care who turn up every day, and I know how hard they're working just now, and how tired they are. They've had not just a couple of weeks of hard work behind them, but actually this has been going on for months now, and that cumulative fatigue has an impact on people. And when I speak to them, I recognise their unease and their anxiety at times about what they're faced with ahead, because there is some uncertainty for them when they turn up at work as to how busy they're going to be and just exactly what they're going to be faced with over the day. That's as healthcare workers, that's, I guess, one of the things that we have become used to, but we should never underestimate just the impact that that has on individuals at all. In terms of PPE, we continually reassess the quality and the use of PPE against evolving knowledge. Only last night I took part in a UK meeting of senior clinicians from all the 4 nations, where again we examined data from across the countries looking to see whether there was any evidence that the PPE recommendations and requirements needed to be changed in view of the experience with the new variant of the virus that we're seeing just now, and there's no evidence at this point in time that that is necessary at all. In fact, what we heard was some examples of really good practice from some of the sites, particularly in the southern part of England, who are experiencing much greater challenges than even we're seeing in Scotland just now, and the approaches that they've taken to how they try to again address both staff concerns, but also reinforce the way that PPE is used within their hospital sites as well, but no formal recommendations in terms of having to change the actual requirement for PPE in the various circumstances that are outlined in the guidance at this point in time. There is no evidence that the increased transmissibility of the virus requires a change in the type of PPE that is required.
Fraser Knight from Global.
Thank you, First Minister. You spoke about the NHS coping well just now, and we know that the pressures are immense. That we saw yesterday a number of ambulances turned away from the emergency department at the Queen Elizabeth Hospital, diverted elsewhere. And we know, or we've heard reports of patients having to wait hours in an ambulance to get into emergency departments elsewhere in Glasgow. I was wondering what the situation's like elsewhere. Is this a picture we're seeing across the rest of the country, or are just a few health boards struggling? And if I may as well, just on the Louisa Jordan, we know it's being used at the moment for some non-COVID procedures. I was wondering what the process would be to start accepting COVID patients in there. Is that likely to happen anytime soon? Or has the policy changed that it will continue to just deal with non-COVID patients?
We keep the use of the NHS Louisa Jordan under review. Gregor might want to say a bit more about that. We're not planning, as things stand just now, to use it for COVID patients, but as I say, that is kept under review, and it's not been lying idle for the past few months. It has been seeing thousands of outpatients, and it's been used as a site for training of staff and students as well. On your other points, just maybe briefly on the situation in Greater Glasgow and Clyde yesterday, I think you heard in my opening remarks, I am not in any way trying to underplay the pressure on our NHS. It is severe and it is increasing, and it's one of the main reasons I'm asking all of you to please stay at home to help the NHS cope. But I suppose just to give a bit of context, and I spent, as I was commenting the other day, 6 years as Health Secretary, and then the last 5 years or so as First Minister. So I know that every year, and often the first week in January, is the busiest for the health service. So this concept of a board like Greater Glasgow and Clyde managing its bed capacity across all of its hospital sites and maybe diverting patients from one hospital where there's greater pressure to another of its hospitals where there's less pressure, that is not unusual. That will happen routinely during busy points. But that said, the health service is extremely busy. And of course, the last few days, we've also had very icy weather. So accident and emergency departments will have been coping with falls and slips as well. So, you know, we really can't emphasise enough the pressure that is on the health service and the role all of us need to play to try to help alleviate that. In terms of whether that is across, so that, you know, across the country, the health service is under pressure and those working at the front line of it under significant pressure. The position varies from health board to health board. So as I indicated in Parliament earlier in the week, Borders, Health Board, Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, these are the ones that have seen the greatest pressure. But I don't want anybody to get the sense that there is any part of the country right now where the health service is not under pressure, and it needs all of us to play our part in helping the heroes that work in it to cope and do the job that they are doing in such difficult circumstances.
We're pretty much in daily contact, at the very least, with all the sites across Scotland as we kind of look to see how we can support them and understand the challenges that they're facing. And as part of that, we constantly review the use of facilities like the Louisa Jordan. At the moment, it's designated as what we call a green site, so that's for non-COVID patients, and it's been an extraordinarily useful facility to be able to make sure that we still see patients from, I think there's been 4 health boards have been using it, particularly for their outpatients and their diagnostic services, in a way that we've seen thousands of patients literally go through the doors there and receive treatment or tests that they might have had more difficulty accessing had it not been open and available to them. We've also been using it, as the First Minister said, as a training facility, and again it's been incredibly useful to make sure that this safe site, that we can take staff through the proper training at a time when sometimes that could be difficult given the pressure on services back in their own boards. And the last thing that it's been incredibly useful for is now with this phase in terms of a mass vaccination site. So I'm aware that many of the staff from Greater Glasgow Health Board have been attending there to receive their vaccinations, and because of the size of the campus there, they've been able to be seen and processed through that vaccination safely, quickly and in large numbers.
Shona Duthie from Original 106.
Thank you, First Minister. Understandably, you've said you're more concerned about the virus now than you were last spring, but why have you not put the country into a stricter lockdown as you did then, with things such as professional sport and certain types of work which can still currently continue not being told to stop?
Look, we are in a strict lockdown. You know, when you basically make it the law that people can't leave their homes except for a limited number of essential purposes, that is a pretty strict lockdown. But your question has, I think, a legitimate basis to it, and I actually alluded to some of the ongoing consideration in my opening remarks. Obviously, you know, just to ensure that life with some degree of normality can continue, we always try to strike a balance between keeping people at home and allowing certain things to continue. In the last lockdown, of course, non-essential construction and manufacturing didn't operate for a period. You know, they've both done an awful lot to make their operations safer. But we have to keep all of that under review. At the end of the day, what matters here is that we reduce interactions sufficiently to stop this virus spreading. And given that it is spreading faster, that might be more difficult to do. So that's why I was very open in my statement earlier on, firstly in saying to businesses, please think hard about whether what you are asking your workers to come to work to do is essential. And I mean by that 2 things. Firstly, is it work that even if it is essential, they could be doing from home? And if so, let them work from home. But secondly, is it essential? And if it's not essential, then perhaps for a period, make use of some of the financial support that is there and don't ask them to come to work. Now, businesses in the duration of this pandemic have been incredibly important and helpful and responsible, and you know I expect the majority will continue to be, but they also understandably want to keep their businesses going. But at this stage, people need to prioritise limiting the spread of this virus. And if we think as government that we need to go further in terms of the regulation and the legal restrictions, we will do that, because you know, we have to cut interactions sufficiently to stop this virus spreading. So if it takes more tough decisions for me to stand here or in Parliament and communicate, then that's what I will do, because we see from case numbers, death numbers, the pressure on our health service, we can't allow this virus to run away from us. The consequences of that are just too great, unfortunately. So I would appeal to everybody, individuals and businesses, during this period, think very carefully about the reasons that you're going out and about as an individual and as a business. Think very carefully about the reasons that you are asking people to leave their homes. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask today about school and just wondered if there was a figure for how many children will be learning in school from this week, because some children are in school just now, and compared to the last lockdown. And I was interested in this because I remember in the initial lockdown in March, you talked about how you were concerned that there would be a massive influx of applications from parents for spaces at schools, and you were relieved that that didn't happen. But there seems to be some suggestion that there has been more applications this time. And I just wondered, say, if there were more children who would be in school, and if so, how would that impact on efforts to deal with the virus and the new faster spreading strain of it? Thank you.
So thanks, Katrine. And actually, in many ways, this question has a relationship to Shona's question that I answered previously. So in terms of the figures, we don't have those figures right now. We will be gathering these figures on a daily basis, as we did when schools were closed previously. And I think from Monday, we will have these figures on a daily basis, because that's when, you know, the schools are, the sort of extended holiday period was due to come to an end. So those figures will allow us to get a sense of the numbers of vulnerable and children and key worker children that are accessing in-school education. Now, to give some context, in the last period of school closures, that I don't think that ever got above 2% of all children. I think it was around 1.5, 1.6% of children. Anecdotally, like you, I think because this is the relationship to Shona's question, that there are fewer businesses right now legally required to close, then the demand for that may be higher. And that will be one of the things that we have to look at. If that figure is indicative of the fact that too many people are still being required to go to work, that may feed into our decision making around the balance between, you know, asking businesses to be responsible and putting more of a regulatory underpinning to some of this. So these are things that we are looking at very, very closely, you know, those kind of figures into next week. But already just now, you know, traffic flows, how much traffic is still on the roads, how many people are still using public transport, to give us a sense of, and this is just to be really clear with people, this is not because I take any pleasure in restricting people's movements, but this is quite a simple scientific equation when you boil it all down. We have to get this virus under control, particularly now that it's faster spreading. We have to radically reduce the number of interactions that people are having, and that means radically reducing the extent to which people are moving around and having the potential to come together, and maximising the amount of time people are staying at home. It is that simple. And if we don't do that sufficiently through the regulations we have in place right now, we will have to consider going further. But in the meantime, I just appeal to everybody to remember why this is necessary and to try to limit your reasons for being out of your home as much as possible right now. Rachel Watson from the Mail.
Thank you, First Minister. This is a question for the Chief Medical Officer, if I may. There are reports this morning from that senior clinicians have advised or asked that over 65s and vulnerable people should be told to shield until they are ready to get their vaccination. Is that something that you would support? And are there discussions on whether something like that might be brought into place or underway?
Yeah, so you'll be aware that we have identified a number of people across society who have particular vulnerability to COVID and to infectious disease, what we call the clinically exceptionally vulnerable group. And I wrote to all of them this week. We alerted them that we were now making the advice known to them that they should effectively go back into a position where they were trying to restrict their movements as much as possible. And if they were in work, that they should work from home, and where they couldn't work from home is that the fit note that I will issue this week to all of them could be used with their employers. It's a little bit more complex as you get towards the other groups, such as the over 65s, and using that as a risk factor. I think my main advice to everybody, but particularly those who are in those older age groups just now, is that we should all be trying to limit our contact with other people as much as is possible, that we should be very watchful of when we leave our houses to go to places where other people might congregate. For instance, if we have to go to a supermarket for essential shopping, that we should try to take advantage of quieter times in the day, and we should make sure that we're following all the precautions that are advised in terms of making sure we're wearing our face coverings, that we're trying to avoid any kind of crowded spots, that we're using the kind of cleansing agents that are available to people, and that we're limiting the length of time that we're actually out in those places as well. So my advice very strongly to all those people in those older age groups is to think very carefully before you go out to any place where other people might be congregating. However, the other side of that, of course, is that it's good for us to be able to still to get outside when the weather allows us to do that safely, and to make sure that we're taking advantage of time where we can get out and take some physical activity as well. So there's a balance which is to be struck in terms of protecting ourselves from the risk of direct COVID disease, but also ensuring that actually we're maintaining that ability to be able to still get a little bit of time outside when we're able to. And we know that the risk of transmission is much less in those outdoor spaces as well. So although we're not advising people in those older age groups to formally shield at all just now, I think that taking a cautious approach to this is the right thing to do.
Thanks. Tom Martin from the Express.
Hello, thank you, First Minister. Could I just follow up from your opening remarks on the number of vaccination sites being operational from Monday? Just given the challenges posed by the rural nature of large parts of Scotland, do you expect deployment to be at a sort of slightly slower pace than we would see in urban areas or other parts of the UK, for instance? And have you got any update on plans for mobile centres to help with delivery in those areas? For example, do you know how many you're going to need? Is it something that the armed forces could potentially deliver, like they have help with testing in some places?
So all very reasonable questions. So I think as most of us in Scotland know, there are often greater challenges in delivering health services in rural, remote populations than there are in urban areas, and in particular city centres, although those kind of areas have their own challenges. But no, I don't think I would expect and wouldn't want to see a slower pace of deployment. But how we deploy may be different. So the 1,100, I think it's about 1,190, although don't quote me to the final one on that, sites that will be operational from next week. The majority of those are GP practices, so they are already in locations that take account of rurality and the remote nature of populations. Others will be at community vaccination centres, so community hospitals, health centres and other places. Now, into that, particularly in more remote areas, will be added mobile vaccination units, and we are still working through with health boards exactly how much of that is needed and in what areas, and health boards are in the lead of that planning. So I don't have the figure right now for exactly how many mobile units there will be, but we will update on that as soon as we have that certain. And this is not so much relevant to remote areas, although they're included in this, but later on, and by later on I mean a few weeks from now, not months from now, we will see community pharmacies starting to deliver vaccination as well, and we'll also see in strategic locations across the country mass vaccination centres. Now, why don't we need them right now? Because we don't have the volumes of supply to require that right now. But as we get greater volumes of supply, these bigger mass vaccination centres will become more important, and work is underway right now to identify and establish all of these in time for that supply coming forward. But from next week, just to be clear, 1,100 and something sites will be up and running across the country, delivering this vaccination, with the priority being the over 80 group in the first instance. The Armed Forces, we do have input from the Armed Forces around the logistics and some of the planning of this, and we'll be continuing to work with them. And on this, just as was the case with the original planning for the NHS Louisa Jordan, some of the logistics that they helped us with at the earlier stage of the pandemic, I'm hugely grateful to them for the contribution that they make. Don't know whether you want to add anything on that.
There's no doubt about it. This is the largest logistical exercise we have ever undertaken with an immunisation programme, and as I say, we've looked at the experience we've had over the years with a variety of different methods of delivering vaccines to people, and in amongst those over 1,100 venues that are across the country. It's the fact that we've got over 750 GP sites involved in the delivery of this vaccine. The Oxford AstraZeneca vaccine has enabled us to be able to take the vaccine more readily into communities and be able to use these sites in a way that we can deliver vaccines really readily. And again, just a tribute to my colleagues across community and primary care for the way that they are kind of stepping up and looking for ways that they can support the introduction of this immunisation programme at scale and at pace.
Right, Scott McNabb from the Scotsman.
Yeah, thank you, First Minister. The Scottish Hospitality Group have released figures today showing December was the worst in living memory, trade down 80%, but also voicing concerns again about delays to funding, support funding being paid out to firms in time. I'm just wondering if you're satisfied this emergency funding is getting to the front line quickly enough. And also, if I may, to the Chief Medical Officer, you alluded in your earlier remarks to the fact that hospital cases were around their April peak, around 1,400 today, but intensive care was well below the April peak. Is that down to improvements in treatment for people who have contracted the virus? And if so, could the Chief Medical Officer explain a bit more about the nature of these improved treatments as opposed to sort of the focus of vaccination? Thank you.
I'll hand over to the Chief Medical Officer in a second around treatments, but just to give a bit more detail on those figures, the 1,467 patients in hospital as of yesterday, that compares to around just over 1,500 at the peak in April, so that's getting very close to that peak. By contrast, the 100 COVID patients, it's more than 200 overall in ICU today, but the 100 COVID patients compares to a peak in April of about 200 COVID patients in ICU. So Gregor will talk about the reasons why we're seeing fewer people in ICU. The final point I'd make on that, though, is that I don't want anybody to take that as a sign that ICU is not under pressure. It is under severe pressure, because it's not just COVID patients that need ICU. If you have a car accident or a heart attack or something else that means you require that, then you want a bed to be available to you. And there are over 200 patients in total, 231 patients in total yesterday were in ICU compared to 220 the day before. And that number is above the baseline capacity of ICU. So that's above what it would normally be in a winter. So ICU is under severe pressure, just that we're not seeing the same levels of pressure from COVID on ICU as we were earlier on, but don't take any assurance from that our hospital services are not working extremely hard. On the hospitality point, December was a horrendous month for hospitality. Much of last year has been horrendous for hospitality. I think that's probably true of many other sectors and the population at large, but hospitality's absolutely been at the sharp end. Am I satisfied? I always want things to happen more quickly, and I want to see the money, the substantial amounts of money we are rightly making available to businesses that are impacted, get to those businesses as soon as possible. There's more than 2 billion gone to businesses already, and with in hospitality in particular, where businesses are closed for a lengthy period, the money is paid every few weeks, so it's an ongoing support. And the Finance Secretary announced just before Christmas top-up payments for hospitality to take account of the particular impact over the festive season when hospitality businesses tend to make a significant amount of their yearly profits, and the top-up payments will be in the January payments for hospitality. So we'll continue to work. Money is administered through local authorities. We'll continue to work with local authorities to speed the provision of it up as much as we possibly can.
Yeah, I was speaking to one of my intensivist colleagues, Mike Gillis, first thing this morning actually, and we were looking at the situation across Scotland in terms of intensive care and the impacts it was having both in the units and in the staff who are working there just now. And there's no doubt about it that some of these units are under incredible pressure just now, coping with the type of patients and the complexity of the patients that they're seeing just now. All throughout the last 10 months, we've seen this group of very specialist staff across healthcare really step up and have provided us with really superb support and treatment of the population who come through their wards. There's no doubt about it, the treatments have really progressed since those initial months in March and April last year when we started to see people first going through intensive care. We understand an awful lot more about the disease and how it progresses, and of course we now understand an awful lot more about how to manage that, particularly in terms of the respiratory support that people need. So there are different ways that we now support those patients as well, using other means of making sure that we maximise the oxygen that those people receive to ensure that we support them as the body deals with the infection. We've also got new treatments which are available to us that we didn't have right back at the beginning as well, that can influence the course of that disease as well, particularly treatments like dexamethasone, which when used in the right way can really influence the outcomes for people as well. And I expect that more treatments will continue to come through as some of the trials begin to report their findings and new medications or new approaches that we can use in these areas as well. So we shouldn't assume that because the numbers are lower that these units are any less busy or are dealing with any less complexity, because they're not. But what we're seeing is an awful lot more tools in our chest and the ability to be able to manage these people and influence the outcomes that they have.
Thanks, Gregor. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just wanted to ask you about a report in the Herald this morning that thousands of GPs and primary care staff are yet to be vaccinated, and some have expressed concern that because of this it's not safe for them to vaccinate others from next week. I just wondered if you could say what proportion of GPs and primary care staff have been vaccinated, when that process will be completed, and is it safe for them to vaccinate others if they haven't themselves been vaccinated? Also got a question for Dr. Smith. GPs in England have been instructed to stand down routine care to prioritise getting needles into arms. And I just wondered if similar advice is going to be issued to GPs up here. Thank you.
I'm going to hand over to Gregor on the question you directed to him, but also on part of the question you directed to me on whether it's safe for GPs to vaccinate people when they've not been vaccinated. I think it's better that a clinician answers issues of clinical safety rather than me. But on the question, I can't tell you right now that this is the kind of detail that will be in the Public Health Scotland reports in future in terms of the specific percentage of each group that has been vaccinated. So I can't tell you right now the number, I can't break down the number of health professionals into GPs and other professionals, but if you take health and social care, we're getting close to being halfway through the vaccination programme for them, and there'll be more detail of that given in future weeks. So vaccination is open for GPs, but obviously because of needing to get supplies coming through, it takes time to get through everybody. But the progress around that is going well and is going reasonably speedily, and GPs and other health professionals will know how to book in for their vaccination. But on the safety issues, I think it's probably better that Gregor answers that and then also takes the question specifically for him.
So two parts to this question then. First of all is to say yes, it's safe for GPs and community-based staff to vaccinate people in those circumstances. It's safe because we're not recommending that anyone who's symptomatic receives vaccination. We're not recommending that anyone who's symptomatic leaves their isolation to get vaccination. It's very important that we realise that it's people who are well that attend for vaccination. And of course, the vaccinators themselves are still wearing PPE as well to make sure that they're still got the same level of protection that they would have if they were coming across a patient for any other circumstance as well. So yes, it's safe for those people to participate in the vaccination programme. I've made it very clear in my discussions with colleagues and with the health boards that I expect that GPs and community-based staff will be given equal protection and equal access to the vaccine, and I'm delighted that in the reports I've been receiving is that there are very large numbers of people from those sectors of care who've been receiving that as well. In answer to your second part of the question, we've not issued any kind of statement at all to GPs to stand down normal care just now. In fact, it's really important, particularly at this time of the year, that people are still able to access care when they need it, and there's no specific instruction which has been given about any particular type of service that GPs should be dropping at this time in order that we kind of concentrate on the vaccination. And I know from discussions, again, with colleagues across general practice that they're finding things are exceptionally busy just now as people present with them with the different types of winter illnesses that you would expect.
Thanks. Chris Musson from The Sun.
First Minister, you said in your opening remarks that from Monday you'll publish the daily number of people vaccinated. But we touched on this earlier in the week. I think to measure meaningfully like how the programme is performing, the public would need to know how many doses have been delivered to Scotland on any given date. So will you publish these too daily? And if not, why is there a reluctance to do this? And just secondly, on Good Morning Britain this morning, you said you might need to go a bit further in restricting non-essential business activities to further cut the spread. Can you explain a bit more what you mean by this? What businesses could be restricted further? Thanks.
I have done already in previous answers, so I've kind of substantially talked about that last part, you know, the things that might have been restricted previously and are not now. And don't take this as decisions, but, you know, construction, manufacturing, you know, click and collect services, these kind of things. I noticed in the Republic of Ireland yesterday, in their latest restrictions, they've restricted click and collect and non-essential construction. That shouldn't be taken as an indication we're definitely going to do that, but that's the kind of thing we need to look at if we have a concern that we're not sufficiently reducing the number of people that are out and about and interacting. Look, Chris, I suspect there's probably no amount of information I could stand here and commit to publish that would ever satisfy journalists, and that's perfectly understandable. We're trying to publish as much as possible as we go along robustly. We have statisticians that get very irate when governments publish things that are not on a robust level. So we will publish more, and I would hope that we would, as we go along, publish more around you know, supplies on a daily basis as well as vaccinated. But these are all things that everybody's juggling just now to model exactly what we do and get that done. And as I've said before, there is always a balance between the pressures you're putting on an already overstretched system to produce more and more statistics versus what you're allowing them to focus on doing in terms of the really important stuff that has to be done. So from Monday, we will publish the numbers being vaccinated. Public Health Scotland will provide, as soon as possible, more breakdown in the weekly report that they provide. And if it becomes possible to provide that kind of information on supply on a sort of regular, frequent basis, because supplies are still the bit that we have, I suppose, most uncertainty around right now, then we will try to do that as well. So we're not reluctant to do any of this. That's very pejorative language, but sometimes things are a bit more complicated than they can be made to sound. Tom Peterkin from the P&J.
You say it's pejorative language, but from your response there, you do sound reluctant to release this information. You talked about the burden there, potential burden on administration. What would this additional burden be? Because presumably you and the Health Secretary have these figures in your head on a daily basis of how many vaccines you have available to you. I'd be surprised if it wasn't the case.
I've got more figures in my head on a daily basis, Chris, than you could possibly ever imagine. And, you know, there's a balance between the figures I carry in my head and the other things I carry in my head and figures that I have to go and refer to. The supply issue is one of the things we're trying to, because it's not just as simple as what you have on a daily basis. We have to look ahead at what we can expect to get over a period of time. If we used every last dose we had on a daily basis, and then the supply for the week ahead was less than we thought it would be, then that would impact on what we had to do. So that equation of how many are done every day with what supply you have every day, it might be quite simple to kind of pose that to me as a question. It's not that simple when you're modelling a whole vaccination programme. So it may be that it makes more sense, I don't know, talking slightly off the top of my head here, to do that on a weekly or a monthly basis. But it doesn't necessarily make sense to do that on a daily basis, because you would always want to have some supplies held back. We talked the other day about some of the around the edges of the spillages and wastages you have in any vaccination programme. You will always want to have some contingency for unforeseen events or for supplies in the future perhaps not coming through the way you expected. So I don't think it would be sensible to do that match up of supply and demand on a daily basis. As I say, it might be possible and sensible. Even if it was possible to do it on a daily basis, it wouldn't necessarily be sensible, because if one day, for example, it showed that we had more supply than we administered, there would be very, very good reasons for that. But what you and your colleagues would put in your front pages is that we weren't using all of the vaccine that we had. So let's be sensible about this.
First Minister, it's up to you to explain that. It's up to you to explain that.
I just have.
That's right. You're casting aspersions about what will be put on front
Chris,
pages.
I am not casting.
It would be up to you to explain the position.
I just have explained the position, and that's what I try. That's why I stand here every day. And if at times I sound as if I'm getting a bit impatient, that's because probably sometimes I am, because this is difficult for all of us right now, and I've got the responsibility to make sure these things are done and to explain them, and I never complain about that. But the point I'm simply making, and don't take it as casting aspersions on you, because it is not. But just as you're entitled to sort of question me about things, I have got a right to set out some of the ways in which sometimes these things are just a bit more complicated than a question can make them sound. And that's what I've done. But it is not, when you say I'm reluctant to do things, with the greatest of respect, that is pejorative language, because it sounds as if I'm trying to hide something, as opposed to having reasons why what you're putting to me may not be the most sensible way to do it. So hopefully I've managed to explain it a bit better than perhaps I have previously. Tom Peterkin from the P&J.
Afternoon, First Minister. The reports of 19 deaths at the Lomond Court care home, Glenrothes, given the tragedy that's unfolded in care homes during the pandemic, I just want to know what your reaction to this is, and whether you're satisfied enough is being done there. Also, there's some concern about hotspots, COVID hotspots in the Highlands, in communities around Inverness, Bewley, Dingwall, Invergordon, Allness and Caithness. I just wondered, are there suspicions this may have been linked to Christmas gatherings, or how much can be put down to the new variant?
In terms of outbreaks and deaths in care homes, I don't think I'll ever stand here and say I am satisfied that enough is being done. We always have a duty to try to do more to stop the virus getting into care homes and stop it circulating when it is in. And the vaccine is, the biggest tool that we now have to try to protect care home residents. In terms of hotspot, obviously mainland Highlands are part of the lockdown now. So, we have a concern not just about hotspots in the Highlands, but about the general levels of community transmission there. It is entirely the case that it is a concern in the Highlands or anywhere else that if people are interacting in other people's houses right now, that is going to help spread the virus, which is why one of the key pieces of advice we're giving to people is please don't do that. Please stay out of other people's houses unless it is essential. Andrew Learmonth from the National.
Thanks, First Minister. We know now, I think, that one important factor that makes the new mutation more transmissible is that people infected produce much more of the virus in their upper respiratory tract. Do we need to change any of the guidance? Would the CMO recommend people wear masks outside? And can I just ask for some clarity on breastfeeding? The leaflet, the letter most of us received this week says mums should wait until they finish breastfeeding before taking the vaccine. But the advice from the GCVI has changed now. What would you tell breastfeeding mums watching this briefing? Should they get the jab?
I'll hand over to the CMO on both of these.
Yeah, we don't yet know exactly why this new variant is so much more transmissible than the previous variant. There's lots of theories around. Viral load is one of the various theories which have been proposed as to why people may be more infectious when they have this. Viral load's also often associated though with more severe illness, and we're not seeing that translating through at all. So there's a mismatch there that we need to understand a little bit better. There's also a very strong case, I think, to be made for what we call increased binder affinity to the receptors that allow the virus access to the body's cells in order that it can start its replication cycle as well. And I suspect that we're going to find that the virus has a part to play there in terms of its increased transmissibility. Aside from that, at this moment in time, we constantly review the guidance that people receive in terms of how they can best protect themselves. At this moment in time, there's nothing to suggest that the basic guidance which we speak to you about every day, about the distancing, particularly the 2 metres distancing that we've recommended, should change at this point in time. The mechanics of that droplet spread, for instance, haven't changed. So the 2 metres as being a reasonably safe distance that we recommended beforehand remains the case even now. And there's no evidence at all that the actual mode of transmission from this virus has changed in any substantial way as well. So that guidance is still very firmly there. However, I think that we should be cautious, particularly in relation to when we become closer than 2 metres, because again, if this virus is much more easily transmitted, then it becomes even more easily transmitted the closer that we are to each other as well. And that's why one of the reasons that we've made the recommendation this week for the to remove the 1 metre exemption for workplace canteens, put that to 2 metres, where we know that that will kind of help to safeguard people in that environment a little bit more. We'll continue to keep it under review. We'll continue to look at the science that exists behind this to try to understand what it is about this new variant that actually makes it more transmissible. But the location of the mutations in the spike protein certainly attract me to the theory that it's possibly got something to do with, as I say, this receptor binding affinity at the base of it, as well as other things.
Thanks. Kieran Andrews from The Times.
Thank you, First Minister. The number of deaths not linked to COVID or other major medical conditions increased from 16 at the end of November to 58 in New Year week, according to the National Record of Scotland stats out today. Is there any further detail available about the cause of these deaths or what's behind this fairly large increase?
I don't have further detail. I'll hand over to Gregor on this. It often takes a bit longer for more investigation and exploration of excess deaths that are not obviously linked to a particular cause to develop. But I don't know whether Gregor's got anything more he can add to that today.
I don't have any additional detail on those particular cases that you're speaking about just now, but those will be developed over the coming days and weeks, and we can share those once they're available.
And lastly today, David Ball from The Herald.
Thank you, First Minister. There's been calls for universities to remain closed in line with schools. I'm just wondering if that is being actively considered by the Scottish Government, and whether all students are likely to be tested on their return. And also, Donald Trump seems to have given up all motivation on trying to suppress the virus and also running the United States. Is it now, with global sort of efforts so important to tackling the virus, is it now a case of having to wait until Joe Biden is president to have any meaningful conversations with the United States government about tackling the virus?
On universities, we had already pre-Christmas agreed a staggered return of students, so not all students are coming back. And the staggered return that was agreed before Christmas would extended into February. It was a 6-week staggered return, and part of that was offering testing to students coming back, similar to the testing they'd been offered before going home for Christmas. I said in Parliament earlier this week that we were considering and discussing with universities whether that period of the staggered return had to be extended, and those considerations are ongoing, and the Higher Education Minister will set out any conclusions of that fairly soon. But at the moment, students will know from their university when, as things stand just now, they are expected to return. I wouldn't rule out that changing, given the severity of the situation we face, but we'll set out details on that when those discussions have concluded. And I feel as if I need to congratulate you for being the last questioner, but the first one that managed to shoehorn Donald Trump into this briefing. You're absolutely right, of course, that apart from all of the other feelings and views that we all experience when we watch events that are unfolding in the United States right now, I think one of the things that certainly I always think about is the fact that the virus is spreading very rapidly in the United States, and there doesn't appear to be much of a focus at all from Donald Trump on the actions that are taken to suppress it. So that's perhaps just one of many reasons, but perhaps one of the most important and immediately pressing reasons why the sooner we get to Inauguration Day for President-elect Biden, the better. But I'll probably leave it there at this briefing in terms of my comments about the soon-to-be former President of the United States. Thank you very much to all of the journalists for joining us with the questions. Thanks to Gregor and to Anna for our BSL interpretation today. Thank you to all of you for joining us. I will end really where I started. Please stay at home right now as much as you possibly can. Only leave your home for a genuinely essential purpose, and really ask yourself, every time you think about going out, ask yourself if it is really essential to go. Nobody wants to be stuck at home. Nobody wants to be away from their loved ones and restricted in all of the things we enjoy doing in life. But right now, in the position we're in, it is essential that we do that, because it will stop, or not stop, because you can't guarantee that, but reduce the risk of us getting the virus or passing it on to somebody else. And every person that we reduce the risk of getting this virus, every person that doesn't get the virus is one less person that will end up in hospital, intensive care, or perhaps dying. So we protect ourselves, people we love, and we protect the NHS as well. So please stay at home, protect the NHS, save lives. I cannot stress the importance of that message enough right now. I'll be back here tomorrow at 12:15 for tomorrow's briefing. We'll be back really from now to a 5-day a week rather, schedule for briefings. They won't always be here. Sometimes they will be from the Scottish Parliament, but this daily provision of information is important as we go through this next phase of the pandemic. So thank you again today for joining us.